Welcome back, guys. This is Sunny with Infinite Motive, and this is part 4 of my cancer journey that ultimately led to the creation of Infinite Motive. In the last part, we were going over basically the end of my treatment, going into remission, hopefully finishing this treatment plan without having to go through bone marrow transplant. Shortly after celebrating with family of me going into remission, I unfortunately fell ill and went and got blood tests done, and sure enough they showed 46% blasts in my cells, and that was considered a relapse. The only option moving forward at this point, after trying to beat the cancer with just chemotherapy, would be bone marrow transplant. And fortunately enough for me, we had already gone through the process of seeing if I had a sibling match. You want the closest, either 100% match unrelated, but the top would be 100% obviously related sibling match. And fortunately enough for me, my sister was 100% match. Going forward, this would give us at least some peace of mind. Obviously you're still concerned and you're still worried, and you're back in another battle that, if you listen to the previous parts, I wasn't really too confident in being done with to begin with. The unfortunate part would be that we had plans to move back to Las Vegas from Houston. We were excited for these plans, ready to get my life back on track. Of course, I was not too confident in staying cancer free, and that ultimately came to fruition with the relapse. We ended up needing to get a larger apartment, because when you go through the process of getting ready for bone marrow transplant and going through the process of the transplant, you can't have a mixture of other people in your room. You need as clear of an atmosphere as possible that you can create to limit the chance of infection, because the chances of infection are so high when you practically have no immune system for a while and then introduce a new immune system to which you're basically like a newborn baby, and you are susceptible to infections of everything around you. So we ended up having to relocate to another place within our community that would be a bigger apartment complex, so that we could do that. The next step was to just try to create as clean of a space as we could. So my parents actually ended up purchasing a couple like industrial grade air filtration systems for the place, and that's again just to limit the chance of infection, try to keep everything as clean as possible. And I mean, this just to show you kind of how extreme this is. For 3 months I wasn't able to be in the same room as our dog Chief, and for another 3 months post-transplant I wasn't allowed to pet him or get anywhere near him, even if we were in the same room. This just kind of highlights how dangerous your surroundings are when you go through something like this. It's of course a scary time. You get a meeting with a group of people. Actually, it's in a meeting room to kind of give you a preview of what you are going to be looking forward to through the transplant process. Again, this goes back to, I don't know if this happens at all facilities, but at MD Anderson they had a meeting with everybody, and then you have a more private meeting one-on-one to answer any questions. This process it's a huge process. I mean, just from a financial standpoint, this is like a $200,000 process for transplant, and from a logistics side and everything that's needed to go into it, they definitely need to take you through the steps so you kind of can try to grasp what you're going into. And even with all that, you are still going to be blindsided with your fair share of issues that I think everybody goes through in some way, shape, or form. So after we had thought that I was in remission, I got my chest port removed, and that process was extremely painful. They didn't sedate me for that. It's just local anesthetic, and you can imagine that numbing only goes so deep, and when you feel your flesh tearing deeper than what the numbing was covering up, it's a pretty painful experience. And with my situation, I had scar tissue that had grown over my chest port, so they had to burn that away to ultimately release the chest port from coming out. And after that, because I had that removed and that was healed up, I needed to get a new central line placed. And so for me to get another round of induction leading up to the transplant, they needed to put in a new central line. This was an issue that we hadn't dealt with before, was infections dealing with the line, which I would soon experience through having the central line rather than having my chest port. The induction process was another intense regimen of chemotherapy. This time was high dose cytarabine, fludarabine, flugrastim, venetoclax, and idarubicin. Sorry for messing up the names. These are, a mouthful. As far as idarubicin goes, this was the last time I was able to get that dosed to me, because there's a limit due to the toxicity of this chemotherapy. Even if I relapse from here on out, I can never have idarubicin again. The damage would just be too much on my body and my organs. So I started induction October 14th of 2019, and this was another 1 week stay in the hospital, same as I detailed in the previous parts. Just tons of downtime. Obviously everybody's a little bit more on edge due to this being a relapse, and it feels to some extent kind of like a last opportunity at beating this thing. And so we started it October 14th, 2019. I ended up shortly after experiencing another infection, had to return to the hospital October 28th, 2019. During this time, like I said, that was the infection that was in my line. I had to do another trial drug that was supposed to kill any bacteria that was in the line. This was obviously just an added stress to an already stressful situation. The frustrations didn't stop there. Next up was the fact that my bone marrow biopsy, which I first got on November 5th, 2019, was initially insufficient for any kind of evaluation of whether I had cancer in the cells post-induction or not. And this goes back to my counts just not recovering how they used to due to so many rounds of chemotherapy. So we wait a little bit longer, and we made a decision to proceed with the transplant. That decision was made on November 12th. This decision was made with still not enough evidence of whether I was cancer-free or not. My counts just weren't recovering, and I needed to make this transplant happen. So with my doctors getting together, both my oncologist, Ravandi, and my new bone marrow transplant doctor, Dr. Olson, through them communicating, we came to an agreement that I would go ahead with transplant and then be followed up with a year of maintenance chemotherapy that would, like I said, span a year after the bone marrow transplant. And so we agreed on this process. We needed to start the process of getting the stem cells from my sister, which is a fairly straightforward, simple process for the donor. It doesn't take very long. It's similar to giving platelets. There could be some bone pain and some fatigue, but for the most part, the side effects are pretty minimal, and the payoff is obviously so huge. Excuse me. Through the process, it basically goes through, it's a central line is placed inside the donor. Their blood is going to go through a filtration system, and then that separates the stem cells, and ultimately that bag of stem cells is what I will receive as the transfusion for my bone marrow transplant. So from here, I ended up, my sister thankfully was able to go through the process without any issues at all, actually, and she went right back to work. From there, I had to get my counts to, it's called day 0. This is going to be the day that they introduce the stem cells into my body, And I can only explain it as you are an empty vessel. You are introducing these new stem cells into your body, and in an ideal situation, that new group of stem cells will start reproducing within my bone marrow to ultimately create a new immune system based on my donor's cells. And the idea in this is that my cells are cancerous and not reproducing anymore. The new stem cells will be sure to produce the proper cells, and I can ideally move forward cancer-free with my life and a new immune system. So when they do this process, it's pretty anticlimactic. It's no different than getting a blood transfusion. It goes into my central line. It's her bag of stem cells. On day 0, it's known as your rebirth day. This is due to a few reasons, but basically you are reborn in a sense that you have the same immune system of a newborn baby. You have 2 types of DNA, because your peripheral blood is still yours, but your bone marrow blood is your donor's. And from day 0, I would say, till about day 3, things were feeling pretty smooth. It was obviously not fun, and there's still nausea and all these things that you go through, but it seemed like there was light at the end of the tunnel. We were pretty confident. The doctors were pretty confident. And then what ends up happening is all of these chemos that you've accumulated through the induction process and the conditioning process, which conditioning, I should have actually brought that before the talk of day 0. Conditioning happened on November 18th of 2019, and this is when I was given probably what would be the heaviest dose for me, probably because of my physical status at that point. These drugs really took a toll on my body. This was fludarabine and methylene, which is similar to like a mustard gas, destroys your DNA. And followed by, actually right after my transplant, was cyclophosphamide immediately post-transplant. And through all of these drugs, it takes their time to get processed through your system. And by, I'd say, day plus 6 days after transplant is when I started really having a decline in my health. My memory loss was starting to be noticeable for my family, my caretaker, and I started having everything in my body was shutting down. So when it comes to digestion of any kind of food, my stomach wasn't digesting food. I was going through extreme bouts of nausea, vomiting, extreme pain, to where you're bedridden and you can't really move. The issue with this is that they don't give you the option of not moving, because you need to keep up some respiratory strength for your lungs. You can't just stay sedentary all the time. So you are still forced to do walks in the halls, and something as simple as a shower will be the most exhausting thing that you ever go through. You will have the option of the respiratory exercise that they put next to your bed, but they're gonna push for you to get moving most days. And as far as appetite goes, you're gonna lose all of your appetite, and they still want you getting some sort of nutritious substance. So I lived on Orgain shakes. They have a few different options, but that's something just to still keep your body going. And like I said, you're nauseous and everything's so extreme at that point that the last thing you can think about is food. You have no hunger at all, but they will force you to still get something down just so that you can keep going. These issues keep going for a while. I battled infections while I was going through this process, and still inpatient, and I wouldn't actually get out until a month after my my coming in for conditioning. So I believe I got out December 18th is when I exited the hospital. I was sent home with tons of medications. They really tell you that the most important part is the first 100 days post-transplant, because of obvious reasons. Your body is so susceptible to infection. And I was sent home with, I believe it was 16 medications, two medications that need to be refrigerated and administered by my mom at home through my central line. And I believe there was even, and then there's a couple more medications that I would be given intravenously when I would come into the hospital every day post-transplant. So throughout this process, it's not like you just get to go home and everything's back to normal. This is still, you come home, you're feeling pretty terrible, and you will be going back into the hospital for transfusions, checkups, blood work, everything on a daily basis. As I said in my previous parts, these early mornings don't stop. You will continue to do blood work early in the morning. In all likelihood, some sort of transfusion will be needed, and you will be going through even more medications, because they have anti-rejection drugs that you'll be placed on in order to stop your body from attacking the donor's cells, or vice versa. There's endless complications that you can experience, and I have been fortunate enough to be a very mild case in terms of these side effects that you can experience. That's not to take away from the absolute hell that this process is, but it's also a miracle that you can suppress your immune system to the point where it's practically non-existent, introduce a new immune system to take over, and now you have a new shot at life. That's not to simplify the process. There's obviously a lot that goes into it, but it gives you that opportunity. And through the donor process is just, it's such a small price to pay for the donor in order to save a life. And this seems like it all ends there, but there's the entire process that now you are a newborn baby, and you need all of your vaccinations all over again. You need constant care to make sure that you're not getting these infections that can ultimately be what takes you out. Instead of the cancer itself, it could just be some simple infection that you pick up in your surroundings. So I believe that pretty much covers the transplant side of things. From here on out, I'll go into post-transplant side effects in the next part, and more of a survivorship type episode coming up. Thanks for following along. It's been a hell of a journey researching and going through everything that I went through. It's, like I said before, it's difficult to have all of this in your memories clearly. There's a lot of foggy areas. It's been through the help of my mom, and just going through all of the paperwork and all of the screenshots and all the information that we have to piece back together exactly what the timeline was of my treatments, everywhere from the start of it all the way through to transplant, and moving forward to what I said earlier, which is the following year of maintenance chemotherapy that was required as well. So we'll go over that in the next part. Go ahead and like, share, follow, and comment down below. Let us know what you think. Tell us your story. We appreciate it, and I'll see you guys next time. Thanks so much.